Women physiological thing is having a period every month. If you stop that by doctor's advice or as a part of treatment, you don't have periods, that is different. But in a natural cycle, every woman or every girl, like once they start the period, till they stop the periods, they should have a normal cycle. Missing a period, odd one and there, doesn't matter. Maximum up to 3 months is okay. After 3 months, if they're not having periods, they should go in and get everything checked. Going through or menopause or stopping periods too early before 50 years is not good. The reason is when there is no estrogen in the body, it can affect the bones. The bones can become thin. The risk of fractures and all will come.
In this Women's Health series, I have a question. Is it normal for a woman who should have menstrual cycle not to have their monthly cycles? I have gynecologist Marthi with me, and I'll ask the same question to her and we'll dive deep into it. Dr. Marthi, welcome to Soul Sync. Is it normal for a woman who is supposed to have their menstrual cycle on a monthly basis not to have them?
Women, when they're born with some eggs, ovaries or eggs in the common term. Some fixed number of eggs will be there, okay, like a 400, something like that. So after a certain age, by about 11 years, 12 years, the ovaries start developing, and the external secondary sexual characters like breast development, hair under the armpits, pubic hair, all that start. And after, as soon as they start in a 1 year or so, they start a period. It looks like, oh, she started periods, but there is a complex process that goes on. We have a part in the brain that is the hypothalamus. It produces a hormone called GnRH. Okay, that hormone, it influences another part of the gland in the brain, that is pituitary. And the pituitary is a gland in the brain. Okay, and it releases different types of hormones like FSH, LH. These hormones, they work on the ovaries, and the ovaries produce different hormones, estrogen and progesterone. Okay, the estrogen is the main hormone. From top to toe, women needs estrogen for her lovely face, for her nice skin, for her hair. Everything women needs estrogen. Okay, and this estrogen is produced by the ovary. So part of the cycle, what happens is when the woman estrogen starts developing, the lining of the womb, the womb is nothing but where the woman carries the baby is the uterus. Okay, so this lining of the womb becomes thick because of the effect of the hormone. And then once it's become thicker, the women are in the middle of the cycle, the women normal cycle, they say 4 months, 4 months, 4 months. In the middle of the cycle, 4 weeks, not 4 months. 4 weeks is a cycle. Every month the women should have a cycle of this. Yeah, you have the proteins, that's good. So I'm just talking about this. This is the uterus, okay, and this is the ovary, and this is the tube. This is the normal ovary. Forget about all the spots and everything on this, okay? This is a very abnormal uterus. So this is an ovary. The ovary releases the hormone. First of all, it releases estrogen, and that makes the lining of the womb very thick. If you see the cycle of a woman, it will be 4 weeks. In the middle of the cycle, woman releases an egg. That means she's fertile, she's ready if she has a relationship, or if she can easily conceive at that time. So that after the egg is released, the ovary produces a different hormone called progesterone. What does the progesterone do? It forms a bed in the lining of the womb, so it's ready to take the baby. So every month, so when the woman is planning pregnancy, she conceives, then the egg goes, the fertilization happens, and the baby forms here. So that we all know that when the woman becomes pregnant, there are no periods. In general, naturally, every month, these two hormones cause this lining of the womb thick. So when the woman doesn't conceive, it comes as a menstrual loss. So this is the basic thing, okay? In the lay terms, I can explain like that. But this is all controlled right from the brain, hypothalamus, pituitary, and this. It's a very complex process, okay? The two things are there. Normally a girl starts her periods at the age of 11 or 12, and some people, they celebrate it, they can invite people, they do functions and parties and all. But what is happening, nowadays, the period is starting early in women, in girls. We're seeing a 9-year-old girl starting periods, and this is happening everywhere in the world.
Why?
A 10-year-old. There are quite a few reasons. They say the multiple things are there. They say one is the weight of the baby, a child, obesity has gone up. The whole world has become, the obesity has gone up at different ages. If you see a very chubby child, when she starts her things, she's likely to start because her hormones start working very early. The whole process starts. That is the weight dependent as well. And sometimes the hormones, and there's a peculiar thing, I don't know whether you heard about it, using plastics.
Yes.
That is a very, very thing. And they've done a lot of research. Putting the things in the microwave with the plastics, because these plastics have substances which are estrogenic. So that is why you have to be very careful when we feed the children or anything to avoid plastics. Why they say plastic? Plastic is not only for the environment, for our body it is very important.
I have a quick question there. You mentioned that the normal age for a girl to start getting the menstrual cycles is from 10 to 11 or 12.
No. It's normal age is about like 11 to 13.
11 to 13. But you mentioned that, you said that even the younger girls are starting the cycles. And there is a reason that you said. Is it good to have those cycles early, or is it normal?
The hormonal effect starting early, the cycles will be limited as well. What I have to say is the growth of the body, like bones. They say once the estrogen starts thinking, the body, the growth will spurt may stop, something like that, like the bone fusion happens once the estrogenic production and the periods start. It has a generalized effect. And you don't want to see a 9-year-old with breast development and, or not having normal secondary sexual characters, which you don't expect at that age. And especially the starting periods as well. Basically, it's a natural way is to be when the periods come very late, 15, 16, that is also quite range. The normal range is about between 11 and 13 years.
Yeah.
Okay.
I know we have digressed a bit towards this from the main topic about not having a periods for the people who should, but this is very important. I want to dwell a bit deep into it.
Yes.
So you said that in essence you said that your body should be ready to handle the menstrual cycle.
Yeah.
And that the right age is whatever the age, 12, 13, 11, 12, 13. But even the younger girls are starting it because of various reasons. And one of the reasons you said is plastic.
And tumors, they can sometimes, they're very rare, they can have tumors which produce hormones early. So that's a different, it's a complex thing that needs to be addressed. Sure. That's what I mean.
Without going into a lot of detail into it, just want to give something away for people who are watching this. What are the key things, what are the few things that they can do as a parent to ensure that they can help their child to have these cycles on a right time rather than, early? Food is one, you said, microwaving with the plastic. Is there any other thing that I can take?
One important thing is we haven't just coming back. We haven't changed from the topic because not having a period starts right from that. Okay. So we are coming. I'm coming to the point.
Great.
It's called precocious puberty or precocious. When the menarche starts earlier, like 8 years or something like that. The mean is that how you think about lifestyle management. It should start right from the childhood. Oh, this lifestyle thing, giving them good vegetables. After a certain age, people are very particular about, I have to do exercise, I have to eat healthy, I should be, yes, the children should enjoy their life. Everything should be in moderation. Like, I don't want to eat a meal, I want to eat 4 ice creams. That's not the way, that lifestyle management, which we all talk about nowadays, it should start right from the childhood. So that gives a normal development of the child. And also physical health, mental health, exercise, sports, being in sports and everything, okay? The point I come is, why I'm saying not having periods, at the age of, if a mother is there, that all the children are having periods, all the girls, but her daughter is not having periods. She's supposed to have a period, but the age of, should start a period at the age of 11 and 12, she didn't start. And you should see that mother will be very, very anxious. So that is why I'm starting not having periods right from the beginning. The simple thing is, by the age of 14, these are the defined definitions. If the girl did not start periods at the age of 12, 13, no problem, because she takes it from her mother, her grandmother. If her mother started periods at the age of 15, she'll start periods at the age of 15. Like
Genetic.
that. So that history is very important. So if a mother says, that's why the grandmas in the houses are very helpful, They'll say, oh, don't worry, you started your periods at the age of 15. Why do you worry about your daughter? She will start. That will reassure the mother. Because this trend is going that everyone is starting so early, a mother will be so anxious, what is happening to my daughter? Okay, you have to wait. Simple rule is, by the age of 14, if the girl starts the normal secondary sexual characters like breast development and hair and everything, she need not panic. Okay, and if especially in that family, if they started late periods, it is normal. By the age of 14, if she hasn't developed any sexual characters, like no breast development at all, no hair growth, a normal mother will know how the baby is because she does all the washing and everything. Nothing has changed. Then she should worry about a little bit. Okay, is what is happening to my daughter. Okay, in the same way, by the age of 16, the women should start, the young girls should start a period. 16 crossed, she didn't start a period. And she has no secondary sexual characters as well. That will be too late. That's the doctor. She has to take the child to the doctor. So what the role of the thing is, what is a reassurance? To keep it simple, if a girl starts periods too early, they have to see a doctor. At the age of 8, she starts, less than 10 years. If they start, they have to get an assessment of the doctor, I have a patient recently, she's 8.5 years, girl, started periods. So she came, but we did all the tests, they were okay. But so that is early start the periods is a thing. And the not starting periods is also a thing. By the age of 14, if she hasn't had a period, if she has a normal sexual development and the family has a history of late menarche, then women should not worry. So that is about the starting of it.
I have a small question, and again, we can continue on the same topic. What are the numbers on both sides? One, the girls, I would say children, because they're still young.
Yeah, they're children.
Under
the
10,
teenage girls.
Under 10, not even teenage, or who actually, in medical terms, they shouldn't supposed to get the cycle, but they will get this cycle. What are the numbers on that side? And the other side, who's supposed to get are not getting after 16?
I don't know the exact numbers, but it is rare. It is that much I can tell you, the numbers, okay? It is very rare because sometimes people can have tumors in the brain. They may start periods early. They may have tumors in the glands, in the hormone glands, adrenal glands. They can start periods. So there are some rare conditions can be there. So unfortunately, I can't give you the number. I'm not very good with numbers, to be honest. But it's a rare thing, okay? But what I commonly see is these are the things. Another important thing is, when a girl starts her period, sometimes I come across, she's already 16, the girl is doing too much exercise, too many athletes, sports, this sport, football, running, athlete, you name it, everything. Then she won't have the periods as well, because there is a condition, it's called athlete's triad. Triad, we call it. The triad means where the structure of the young girl is totally too much of exercise. It's like a burnt out like that, okay? Then also the hormones at a higher level, they won't be activated. So too much exercise is too thin, going around too much. Then in girls of that age group also, the periods can get delayed.
It's only delayed, right?
So that means a mother looking at the child when doing too much exercise and not started her periods, she should take her to doctor. But that could be one of the reasons. Okay. At the same time, young girls, as you know, when the trend is happening with the teenage girls, they want to look very slim. They want a zero size. Okay. And these teenage girls, they starve themselves. And there's a condition called anorexia nervosa, where the girls don't eat, they want to be. This can happen at every stage. I will discuss in different stages as well. Even in the beginning, as a teenager, a 14-year-old suffering with eating disorders, they may also not start periods. So we are just talking about what happens when the girl doesn't start a period when she's supposed to do. I have gone a step backward for your question. Is there a problem with not having periods? So these are the things we have to look. The next stage will come to exactly. She had a period. She started her periods, but the first 6 months she may not have periods. That is normal. Women should not, mother should not panic. Mothers don't panic because the grandmothers will say for 6 months, everyone, it's a world known thing. Once she has a period, doesn't mean she'll have a period next month immediately. After the first period, she may not have period for 6 months or so. Then she'll have normal periods. Our problem comes, or something what we comes is, woman who is having a period every month doesn't have a period for 3 months or so. What could be the? She says, "Oh, I'm supposed to be having a period on 14th. I didn't happen. It didn't happen. It didn't happen." So, what could be the reasons? That is what your question, isn't it? Am I right in saying that?
Absolutely, yeah.
So we have. I'm sorry, I had to take you a step back because I have to tell because that is also a panic for women, for mothers. When they don't start with periods or when they start periods. So she's not having. The first and foremost in the Western societies or whatever things, we always rule out pregnancy. Because sometimes the girls can be so immature, they don't even know, they may have a sexual relationship, they're not aware of the contraception or something, they may think it's nothing happening, the knowledge may not be there, and this happens even in India as well, because the sex education is not as much as in Western population. They may come across, they may meet a boy, or sometimes this is we are seeing more very sad news is pedophiles. We'll see all these things are happening, and so much trauma is happening to the young girls. So something has happened. She was sexually abused, could be sexually abused, and she may have become pregnant. Okay, so someone having regular periods every month and not having periods, the first thing in our here is we do a golden rule. I usually tell the mom, this is I have to do it. I know your daughter is not sexually active, but before I do anything, I have to do a pregnancy test. That's okay. So that's very important. The second important thing is stress. When they have exams, some girls, when they have exams, they won't have periods. So mothers need not panic, For example, for 2-3 months, with the stress itself, they won't have. The minute they finish our exams or something, or stressful time, so you can give good 3 months, you should leave there. See, after 3 months, she may start with the period.
I'm so sorry. I have a question there. You said that a child, I would say a child, these are kids, who's stressed about writing an exam, and let's say, with all these competitive exams that people are, worried and they're stressed about, they go for like good months to years. And during that period, when they're seriously studying for the exam, they may not have periods for, let's say, 3 months. Just giving an example. What effect that may have on their body purely from a biological perspective? If you can answer, if you can dwell that, explore that, and then we'll continue if that's okay.
Okay. No, not having a period for 2 to 3 months is okay. Okay, nothing will happen. The effect once they stop the period, once they finish the exams, believe me, we hear that a lot in the girls, because as a man, you don't know about your mom and your sister. They must have gone like a missing one period, stress or something like that, and they're getting a period. Or if they had a viral fever, they had high temperature, they were unwell, for example, having an infection like something like a typhoid, where they are unwell for 2 to 3 weeks or something like that. So all this can affect the period. Okay, that is okay for 2-3, and once they recover, the period should come back. Once they feel out of the stress, of course, you may say the stress is there throughout their education, but I'm coming back on the acute stress. Okay, like during any situation where they are for 2 months, okay, but after 3 months, we have to think about it. Why is she not having periods? Okay, for example, she finished her exam, she's going on a holiday, she's a happy girl, still not having a period, then the mother should think, what's going on? I should go and take her to a doctor. So that is the time, 3 months is okay. But after 3 months, the mother should think, oh no, something is going on. So there are some things, there are some conditions, okay? One condition, which is very common, especially in Asians, and there are some areas in northern part of India, like a Punjab population. These are, I'm not talking just like the numbers, right? But the research has been done in India that Punjab-speaking areas, they have this, and also most of the Asians, there's a condition called as polycystic ovarian disease. Okay, PCOS they call it, PCOS they call it. They're different. I was not aware of this condition when I was a teenager, okay? But most of the people know about it because of the media, I think, and everything, okay? In that, what happens is, especially in Asians, we are born with something like insulin resistance. That is common. For example, every race has something or other. We can't help it, okay? Caucasians in general have thin bones compared to others, compared to Africans and Asians, they have thin bones. They can't help it. Like Africans, they have very strong bones and they have so much collagen. So any scar that can form a keloid, they can't help it. They're born in that. Like that, I always quote the same example to my patients. My background is India. I'm from Asia. In my family, almost everyone is diabetic. Okay, like you can ask me who didn't have diabetes. So we are born with insulin resistance. There is a link between the insulin resistance, weight gain, and work of these ovaries. It's a bit complex. It's a bit medical, okay? So you don't need to worry about that, all that, okay? But for a layperson should know that, especially if there is a family history of diabetes, especially if the father is a diabetic or mother is a type 2 diabetes. There are two types of diabetes, type 1 and type 2. In type 1 diabetes, there is no production of insulin. I'm sure everyone knows about insulin. Insulin is the one which converts our sugar into energy, okay? So that insulin, don't have insulin for many reasons. They'll take injections. There's another type of diabetes, type 2, which is very, very common, especially it is related to the weight gain. And also, especially not weight gain, not the waist circumference is very, very important. So when that goes up, they will have insulin. But the insulin doesn't work properly. It's called like a resistance, insulin resistance. That type of family history is there. That means this girl already has some amount of insulin resistance. Okay. Suddenly, if the girl has put on some weight, little bit weight, not much, just imagine she's gone on a holiday or something, then that triggers the whole thing. The insulin resistance will trigger and it will suppress the ovary, releasing an egg. First and foremost, what happens is a regular period means the girl is releasing egg every month. So what happens is these hormonal changes happen in such a way the girl doesn't release an egg. When they doesn't release an egg, what happens is, if you remember in the beginning, I said there are two hormones. One is estrogen, and the next hormone is progesterone. So these girls or young women, they have only estrogen. There is not releasing egg. Only when they release egg, there is progesterone. You understand that? So estrogen, progesterone, like a cycle, it happens every month. So when the hormonal change happens, because of the weight gain, all this insulin resistance and everything, so there will be, egg will be there, but the egg is not released. So the egg is not released, no progesterone, no period. Okay. Not only that, because of this hormonal change, do you think women produce male hormones? Don't know.
Maybe answer is yes.
They do. Yes.
They do.
They do. Yes. Women produce testosterone, small amounts. The ovary produces some testosterone. There's a gland called above the kidney. There's a gland called adrenal that also produces some male hormones. Women need the male hormones. You must have read in the HRT, you must see in the papers, I want my testosterone, all that, in the menopause clinics and all. So women need that small amount of testosterone of this. But what happens is, if the male hormone goes up more than it should be, then the girl starts developing spots, acne, and she starts developing hair on the face, side hairs, burns, and then, chin and the hair. It's called male distribution of the hair. Okay. The male distribution of the hair is abdominal. Women normally don't have abdominal hair, and they don't have hair around the nipples like men. So they develop all this male pattern of hair they develop. That means they're producing the hormonal balance in the ovaries changed. They're not ovulating, so they're not producing progesterone. At the same time, they're producing more than normal male hormone. All this come under polycystic disease, ovarian syndrome. Okay.
So you touched upon the symptoms and also the causes as part of this conversation. And I just want to like put it in a very layman's term, based on my understanding, of course, is when the periods are stopped, the reasons are your male hormone is kicking in more than it needs to be, in layman's
In one
term,
of the conditions.
in one of the condition.
PCOS.
And the symptoms are, you will see, facial hair growth, and the other symptom as it is you won't get the periods as normally you should.
Okay.
Yeah, cool. Let's carry on.
Okay. The other thing is weight gain. Okay. With the weight gain is a very interesting thing. If the girl, a normal girl who is having heavy normal periods, regular period, if she puts on weight, the hormonal pattern happens and the periods stop. At the same time, if she has PCOS, she puts on weight as well. It's a vicious cycle. Cyst means people think there are bubbles in the ovary. That's what they comment. The cyst means it's a very medical term. Okay, in polycystic, they're not cysts because the follicle or the whatever it should be released, not released. So it becomes like a bubble inside the uterus, inside the ovary. Inside the ovary, so the egg which should come out doesn't come out. So it stays inside. So if you look at the scan, they'll have big ovaries compared to normal person, and they have we call them as follicles. Okay, they're follicle. They're not cysts. They're follicles. So polycystic is a little bit misnomer. Okay, I call them simple words. What I tell the patient is, if a person comes, I'll just say, if you put on weight and think your ovaries are sleeping, they're lazy ovaries. They're not releasing their egg. So we have to wake up the ovaries. How do we wake up the ovaries? Lifestyle management.
Okay, now comes the cute part. Okay.
Again, the lifestyle management. You will be surprised. There are how to diagnose the condition and all is medically. We have some criteria. Like we call it the Rotterdam criteria, something. So, for example, having polycystic ovaries, looking like that ovaries, is very, very common. If I scan about 20 people, I may see in 8 people, or even more than that, I may see polycystic ovaries, but they'll be having regular periods. So having polycystic ovaries is not the problem. Having the syndrome, that means having the symptoms, is a problem. Okay, so that is a problem. So what is that syndrome? Polycystic ovarian syndrome, we call it, or PCOS, they call it. What is that syndrome? There are some criteria. One is the girl doesn't have, girl or young lady, whoever it is, they won't have periods, or they have periods infrequently, or they may have very light period once in 3 months or something. They'll have, you need not do a blood test. You know the excess facial hair and everything. The second thing. And the third is, you may find the ovaries on scan polycystic. Okay. Out of the 3, as a doctor, if they have 2 of them, we diagnose polycystic syndrome. Okay. So, for example, if I see a mother brings my daughter is not having a periods, the first thing is I look at her. She may be a chubby girl. I will ask mom with any excess. Yes, she's very worried because she has all this hair growth and all. So that itself gives me an idea. So, and studies have shown that if this girl who is overweight has these symptoms, not having periods, if she loses 5% of her weight, periods start. That cycle goes back. So the insulin resistance comes into that. See, for example, what do you say in diabetic, type 2 diabetic? Type 2 diabetics, there is insulin resistance. They'll be using 100 and all these tablets. They have to take. Suddenly they'll become health conscious and they lose weight, and you'll be surprised the waist circumference goes up, goes down, the waist circumference goes down, and they lose weight. They don't even need so many tablets. That is what you're seeing nowadays, more of these weight reduction injections. All people are buying over the, all this internet and all. So weight, that is all related to so especially the waist circumference is very important. If it grows, the insulin resistance is worse.
How do you diagnose?
You go more with the history.
Okay.
That's why a doctor should be a very good listener. Very good listener. Should take the history. What about the family history? Does anyone have diabetes in the family? Maternal uncles, paternal aunts, anyone has diabetes in the family. All that history is very important. What about when did it happen to you, to the mother? We ask, hey, does she have siblings? What about her sisters? Is this weight gain something new? Okay, so that is. If you want to do tests, we do a blood test. For example, you may not realize when you do a blood test, the hormonal pattern changes. Okay, there where we have that is again some of the pituitary hormones go change and all. Prolactin can go up, LH can go up. All that is medical anyway. Okay, and the testosterone hormone which is also go up. So blood test is a test and also a scan. So how do you diagnose? You take a good history, you do the blood test, and you do a scan as well.
Sure. Now, the cure.
Mm.
What is the cure for this? How one can go
Okay.
about revising their menstrual cycle process?
cycle.
And also, this is again such a emotional thing that they may have. One, they're already, gaining weight, and with women, we associate them with
Yes.
beauty. The other thing is the facial hair, which is definitely a
Yes,
no-no.
yes, yes.
So, how do we revive this situation?
Okay.
And also, if you can touch base on the emotional side of things that they may go through.
Exactly. In this condition, what happens is, first of all, we have to talk about lifestyle management, reducing carbohydrates, all those things, and then increase the exercise. Nowadays, children, they just sit all the time playing. So they should get up and play. So that is why I said that right from the beginning, the women's health, the hormonal health depends right from the childhood. A girl is born, the mother must be conscious about not any child, boy or girl, the lifestyle should start right from the. They're not going out, they're not doing exercise, they're not playing outside, they're sitting in front and playing games and enjoying the fast foods. All the fast food, we know that, like I myself, because I'm above 60 now, I've seen in my life how the BMI has gone up in India. Same thing I'm seeing in America, same here in England. As the body mass index, as the obesity increases, the problems come. So the lifestyle management is the core for it. Okay, that is the first thing. And the second important thing is we should not leave anyone for more than 3 months not having periods. When they take to the doctor will do these basic tests, and the doctor may prescribe tablets to start a period. Okay, and the mother should not panic. Oh my God, why she needs a tablet for a period? No, she may have to start a tablet to start her period. So what we were discussing right from the beginning is, in this PCOS, the woman is not releasing egg. She has no progesterone. So the tablet the doctor gives is nothing but progesterone. See?
I have a question. So now a woman not having a period, it's not causing any physical pain as such, right?
Yes.
And in a way,
she's happy.
I was going to say that as a woman, if I was a woman, I don't want to go through that pain, especially if I have endometriosis along with that. And this is an example. Apologies for all women, but I'm going through endometriosis, and I have very bad lifestyle in terms of eating food. I've got overweight, and now because of that, I'm missing all my periods. Technically, I'm a happy person, but it's not right because you're actually developing PCOS on a side-by-side basis. Is it a right analogy, one? And second thing is, how do you explain this?
No, you're just getting confused with endometriosis and polycystic ovaries a bit, okay?
Okay.
Endometriosis happens in people who are having periods, isn't it? It is caused by the periods, okay? In endometriosis, it's a different thing, okay? Let's not get confused.
No, what I was trying to understand is, as a person, I'm going through a pain, and
you want to stop the period.
I stopped it through a wrong way, which is, your PCOS.
No, you need not stop it.
I didn't thought about it, but it just happened. It doesn't happen that
way.
You're
You're right. Polycystic ovaries, that way you're right. Polycystic ovary and endometriosis can be like sometimes, okay? Endometriosis starts when the woman starts her periods, the regurgitation of the blood and everything we said, okay? After, she may have, coincidentally, she may have the polycystic ovaries as well, okay? But there is a difference that if you look at a hormonal wise, it's a little bit different, okay? In polycystic ovaries, there are no period, but my concern as a doctor will be the lining of the womb, this womb will become thicker and thicker. When it becomes thicker, what does it matter? If you leave it like that, the women is chance of developing womb cancers. When I was a medical student, when I was doing medicine or postgraduate in gynecology, I used to see cancers of the womb after menopause, very late. But here I'm seeing, especially nowadays, people high BMI, polycystic ovaries, more polycystic ovaries. What happens is they produce a lot of estrogen as well in a different form, but that causes the lining of the womb very thick. First of all, you take a woman not taking any hormones, just take her natural hormones. In natural hormones, every woman should have a period every month. Naturally, she misses her periods. Up to 3 months is okay. After that, it's not okay. She should see a doctor. And the doctor will start a period. Why should the doctor start a period? Why can't she leave her alone? Then comes, it is not good, because if you leave like that, she may not even have a period for months and months and years, and she may end up in cancer of the womb with polycystic, if they have a polycystic ovaries. Because the two things are different. In polycystic ovaries, they have a lot of estrogen. There's a lot of estrogen is there. Before many years ago, they used to give hormone replacement therapy because women needs only estrogen, isn't it? From top to toe, they used to give only estrogen. They used to never give progesterone, and they found that unopposed, we call it unopposed estrogen, causes cancer. Okay, so the natural cycle we have to mimic, that the progesterone should be there as well. So that is why what the research has shown is a woman should have at least 4 periods in a year. Then the normal shedding happens. Then she is not at a risk of cancer. Okay,
Sure.
that is very important. So if a woman doesn't have any periods, okay, your next question comes, we are stopping periods for patients. For example, in a conditions like endometriosis and all, because they're having painful periods, I'm stopping the periods. But how am I stopping the periods? I'm giving her tablets. They contain estrogen and progesterone. I'm giving them progesterone as well and stopping the periods as well. That's a different thing, okay? So basically, you have to remember, we should not get...
No, this is very important that you explained, because they're not contradicting. That's why I brought that question up. There is a reason why a person gets the pills to stop the periods as part of endometriosis disease, which includes both.
Sometimes.
And the other side, you give the pills for PCOS, which again doesn't stop, but it actually brings the period. So they actually doesn't contradict. They both coexist.
They can coexist, but we have to look at the history and all. It's a bit complex,
Sure.
It's a bit a higher level of...
No, we're not getting into medical
terms. So that is why I don't want to confuse you. Okay, I don't want to confuse the audience as well, because it's very important that if more than 3 months, if a woman doesn't get a period, that at the same time, if you consider a young girl having eating disorders, okay, she started her periods at the age of 11. She's doing extremely well. She had regular periods till she was 17 and 18. Suddenly, she has this, she goes into this eating disorder. It's a psychiatric condition, and many is a mental health condition, which is very important, which is not being recognized by many people as well. It's even there in India as well, and much more we see in the Western thing as well. Because of some psychological things, she won't eat. When she doesn't eat, she loses a lot of weight. She becomes just bone and skin. Okay, there is no estrogen, no progesterone, because the brain stops producing hormones. That is more dangerous, because women need estrogen for bones. So if you see a patient with anorexia, or some women not having periods, young girl with eating disorders not having periods, they have to take them to doctor and make sure, and the doctor should question whether they have periods or not. So that is often missed by some of the doctors as well. Okay, as a doctor, the doctor should, and mom should say, my daughter is not eating, she lost weight and she's not having periods. And the girl, she should ask the girl, are you having periods? If she says no periods, she should report it to the doctor.
Is it fair to say that PCOS is mostly related to your lifestyle? and food and your living habits?
Yes.
Is it fair to say?
Yeah. It's
I
a
know there
lot
is
of
genetic
link
things that you say.
because it's a lot of link to the insulin resistance. Because it may not happen in people who don't have the insulin resistance. So it is more when they already have an insulin resistance with a familial history and all, just a little bit weight gain will trigger it like that. So not having periods without taking any hormones is not good for two reasons. One is when they put on weight and they lose weight. Not having periods for a good and a happy cause is pregnancy. Okay?
Yeah.
That's good. They don't have
Yeah.
periods, they're pregnant. A positive pregnancy test is a happy girl. And the next thing is menopause. When she reaches menopause, this is another important thing I'm saying. Normally, people stop periods when they go through a menopause. Okay? Usually it happens at the age of 50. But there are some women who stop periods at the age of 40. They say, oh, I'm gone through change. No, those women should see a doctor. Because every woman should have periods, normal periods up to the age of 50. She should have estrogen in her body. Estrogen is not just for facial hair and face, it protects the heart. You see more heart attacks in women who stop the periods. You see men having heart attacks at the age
That's
of 40.
more number.
You don't see why women so many heart attacks because estrogen protects them from heart attacks. So a 40-year-old lady went through menopause. I don't want to take hormone replacement therapy. I hate hormones. I'm happy. And in some cultures, they think they can do more prayers because they don't have periods. They can pray God all the time. But that is very important. Women should go through a change around the age of 50s, not early. If she stops her periods at 40, she should see a doctor. The doctor should see why she stopped the age of 40. If the doctor confirms by blood test or something that she has gone through a menopause, this lady needs hormone replacement therapy up to the age of 50. After 50, it's up to her whether she takes it or not. But definitely up to 50, she should take, or else she becomes thin bones.
You mentioned something. It's a personal question. I don't know if I can ask you, but I'll still ask you. You mentioned that people or the women who miss their periods feel lucky that they can pray. What are your views? Do you think women during the monthly cycle should be allowed to pray or shouldn't be allowed to pray?
It's a personal thing, It's a personal thing, okay? But one thing is that there are things, it will be a bit contradicting to topic whether they can go to the temple. I was speaking to one of your friends as well before the temple. That's a different topic-wise, for example, Muslim women, they pray 5 times a day. They say if they have periods all the time, they come to me, Dr. Marthi, I'm bleeding for so many days. And if they don't have periods, they're very happy because they can do 5 times a day. They can do their prayers like that. So it is a linked thing, but that is a personal thing. But from the health point of view, not having periods or stopping periods very early, the period should go up to the age of 50. If they stop periods completely by the age of 30, there are so many things. There could be tumors in the pituitary which can stop the periods, like prolactinomas. They have to be, or a thyroid problem. Too much thyroid can stop the periods. So basically, to keep it simple, if they suddenly stop periods, they should be investigated.
Some women deliberately stop their periods using pills without any medical assistance. Reason could be, they're attending they are doing a concert, they're playing a sport, etc. Is it safe to do, or what do you advise?
Oh, that's the way. For a short time, it's fine. I get to, as a doctor, as a GP, as a gynecologist, they want to postpone periods, okay? They do that often because she's getting married and she doesn't want to have a period at that time, or she's going traveling and there we give tablets. What do we do is, we give them these progesterone tablets because what happens is that hormone falls, progesterone drops, then the women have a period. So we won't let the progesterone drop, we maintain the progesterone. So that we do temporary, but not, there are types of hormones, some of them can cause thrombosis and all. So that also, for example, somebody going to Australia, we don't give the same hormone tablet. Somebody going to, Paris. Okay, it's a different thing. So that decision will be taken by the doctor, So for that, they need a medical advice. But they can't do that all the time. But they have to have medical advice.
Do you think they get these tablets over the counter, or it's always through prescription?
In India, they can get over the counter. And
Is it
because in
safe?
India they use that is very important. There's especially tablets like Primulith and all. They can keep using that. They have thrombogenic effect. They can cause clots in the legs and all that. So they have to be only for a short time is okay. For the long time and all, they should not do it over the counter. They should take medical advice. In this country, in UK, they can't get it over the counter. We ask so many questions before we prescribe them. We can't just prescribe them like that. We need to know their medical history and what is there any thrombotic risk, where that person is traveling, is it a long flight, something like that. So we have to make a very good decision, appropriate decision before we prescribe.
Sure. Dr. Uma Marthi,
Thank you very much.
it was pleasure talking to you, and I can't wait to again meet you and have a conversation on the other areas of gynec problems.
Definitely.
And thank you so much for sharing your thoughts.
It's my pleasure, and we'll be definitely touch on other topics like menopause and urinary problems in women. There's a lot to talk, but I'm sure time convenient for both of us will do more. And I hope I will be very happy to see the feedback. And if they want any interesting topics, your audience, if they want anything, I'll be more than happy to do them again.
Yeah, please use a comment section to share any questions that you have, because we're going to continue talking to Dr. Uma Marthi on the gynec problems. So please put them in the comments, and I'll try to ask all those questions with the doctor.
Definitely.
Thank you so much.
Thank you very much.